Hello, my name is Sierra Coyle. I'm a respiratory therapist and the ECMO specialist at Transonic. In this video, I will be discussing recirculation in VV ECMO patients, why it's important to quantify it, and how to improve your patient's therapy. Recirculation, a known complication of VV ECMO, occurs when the drainage cannula absorbs a portion of oxygenated blood from the reinfusion cannula. Long-lasting periods of recirculation reduces the delivery of oxygen from the ECMO circuit to the patient. Without optimal therapy, an ECMO patient will quickly decompensate. Historically, recirculation surveillance has relied on subjective measurement, making it difficult to detect and quantify. The most obvious indication is a low arterial oxygen saturation with a high pre-oxygenator saturation. Other subjective clinical data potentially include low PaO2s, increased ventilator settings, change in vasoactive support, and suboptimal cerebral saturations using NIRS monitoring. Regardless of these signs, medical teams still struggle to identify how much recirculation is occurring and how seriously it is affecting the patient. Early detection can lead to faster improvement and successful weaning from ECMO. ELSA, the extracorporeal life support assurance monitor from Transonic, not only confirms recirculation, but also gives an actual percentage of recirculation. Measurements are obtained with a simple isotonic saline bolus. Quantifying recirculation provides the actual oxygenated ECMO flow being delivered to the patient. This allows the clinical team to identify the loss of oxygen delivery to their patients, ultimately determining the quality of the ECMO therapy. Once recirculation is identified using the ELSA monitor, steps can be taken to eliminate and reduce recirculation and optimize treatment. For all VV ECMO configurations, cannulas must be placed in the ideal position within the venous circulation. Take note how each cannulation technique is susceptible to recirculation. Bifemoral cannulations use both femoral veins to obtain ECMO support. Proximity of these cannulas to each other increases the chances for recirculation. Femorojugular cannulations utilize a patient's femoral and right internal jugular vein to provide support. The tip of each cannula faces each other, creating high rates of recirculation if positioning is not perfected. Double lumen cannulas operate with 3 ports. 2 for draining blood into the ECMO system, and 1 for reinfusing oxygenated blood into the patient. While the basis of this configuration is ideal, a poorly positioned DLB can result in turbulent flow, high recirculation rates, and poor drainage properties. Fortunately, specialists can perform a recirculation measurement using the ELSA monitor during cannulation to help surgeons locate ideal placement. High ECMO RPMs increase the likelihood of recirculation. Any VV ECMO flow exceeding the patient's cardiac output causes recirculation. For example, the patient's cardiac output is 3 liters a minute, but the ECMO flow is set for 5 liters a minute. The difference of 2 liters will be recirculated. This does not improve oxygen delivery because the effective ECMO flow the patient receives does not increase. It is important to identify optimal RPMs to provide the most effective ECMO flow possible. High RPMs can increase hemolysis, which can lead to serious complications. When VV ECMO patients are hypovolemic, inadequate preload will increase recirculation. Providing a fluid bolus or adjusting diuretic management should help correct the lack of forward flow through the patient's native outflow tract. A recirculation measurement can be taken before and after the fluid bolus to quantify improvement and guide effective patient management. If the previous steps have not improved recirculation, then the patient's cardiac function may be the cause. Evolving heart failure decreases the heart's ability to pump effectively, reducing the overall cardiac output. As cardiac output decreases, recirculation will increase. Recirculation measurements may help indicate heart failure that can then be further assessed by an echocardiogram. Recirculation has long been known to be an undesirable component of VV ECMO, but has previously been hard to quantify. Transonic's ELSA monitor is a powerful assessment tool that allows for early quantitative detection of recirculation, which can be caused by cannula misplacement, incorrect pump settings, hypovolemia, and cardiac failure. Now, for the first time, clinicians can obtain quantitative recirculation percentages, which they can use to improve their patients' VV ECMO therapy.